Hey guys, Lauren and Rebecca here with Bizrok. In this week's team operations and optimization video, we're going to talk about Osha, which is something that nobody enjoys talking about, right? But every office needs to have an Osha officer and to have Osha protocols. So can you kind of touch on some of the things that you see in practices that maybe they're lacking, or maybe the most important things that they should cover?
So when it comes to Osha, one, we need to make sure that we are maintaining our Osha regulation books once a year. So once a year, the team as a whole needs to have an OSHA training. Mm-hmm. So if you have an OSHA officer in your practice, awesome, you're already a step ahead, thank you. Mm-hmm. So that OSHA officer can actually go and take the class and then come back and train the team and have everybody sign off in the OSHA book once a year. That is so important, that is key, having the signatures once a year. So if you add a team member, same for them. Yes. They need to be sat down with the OSHA officer for the practice and gone over the OSHA class for that year that we're in, and then the new team member signs off on the same page. I always recommend leaving those in the front of your OSHA books and keeping in there for the life of the practice. So eventually you'll have 25, 30 plus sheets in there, and it's just going to be each year, dated with the year, and all the team members' names, and then the signature next to it.
Love that. Which, if you're following our onboarding guide, you will see that's one of the check marks is having those OSHA protocols in place and going over that information. And that is one of those things that we do like to have paper copies of.
Yes.
Why? Because it's just easy, right?
It is easy. It's all kept in one place. We all have the OSHA binder, and it should be right next to your HIPAA binder. So keeping it all together in a central location in the office, we know where to go look. Mm-hmm. That way, if OSHA were to ever do a surprise visit into your practice, you can say, here is our OSHA binder, and it's in regulation.
Yes. Can you touch on maybe some of the most important things that sometimes practices forget, i.e. apple juice, for example?
When I go into practices, I do see a lot of offices, they will have the emergency juice or they have the glucose. It's like a squeeze tube in their ER kits. That is wonderful, but those little tubes are very pricey. Yes. So I always suggest just keeping a juice in the refrigerator. We do need to look to make sure they are in date. So it is something that I ask the OSHA officer to check once a month. So at the end of every month, just go in there, check it, make sure we're in date, and then check it again at the end of the month. Most things have life expectancy. I think it's like 2 years for juices, so you're going to be fine. The other is what type of juice. Most offices always have orange juice, and I actually suggest apple juice. Mm-hmm. The amount of people allergic to orange juice over apple juice in the United States is a lot higher. So keeping orange juice in your practice is great. You're going to have the high sugar content, but more people are allergic to it. So I just suggest that small little kid apple juices that are the no added sugar, just keep it in there. And it's not just good for emergency uses on a patient that may happen to faint during a procedure or before with their nerves. You want to keep it in for your diabetic patients and for your pregnant patients as well. Sometimes they get in a hurry. They want that 8 a.m. appointment, which is wonderful, but they forget to eat breakfast. So then once they get in, they sit for their treatment and they start to feel like, okay, my sugar levels are going down. I need something to quickly boost it. It's easy. So even if the patient's numb, it's something that they can just squeeze in their mouth and digest.
So good. So good. Any recommendations on emergency protocols? Because I know that's a big one that we touch on.
It is. Emergency protocols, you need to have multiple officers involved. So you'll have your OSHA officer, and that is actually the person that is going to go and call 911. Mm-hmm. I always suggest having a doctor, which is normally the owning doctor or the one that is in the practice the most, that is going to stay with a patient during an emergency. And then normally I have a volunteer that will be the one to say, if there's an emergency, I will go with the doctor and stay with the patient. And then last but not least, this is most important, somebody to print out their medical history. And I do get a lot of questions about why we should have somebody print out the medical history during an emergency. It comes down to the first thing that the paramedics are going to ask when they walk in the practice is, do you know if they have any medical history? I love all my patients, but I could never remember all of their medical background. So always go into their chart, print out their medical history, and as soon as you are on the phone and I want to have that in hand, you can start verbally telling them and they will relay it to the paramedics. And or as soon as the paramedics walks in, you can hand them the sheet when they ask that question, and that is all their information. At the same time, I always say print out their emergency contacts.
Yeah, you took the words out of my mouth, because I feel like that's one of those sheets that I would say probably about half, if not a little more than half of our practices, they don't even have that in the new patient packet. And it's like, oh, what are you going to do, or who are you going to call if somebody faints in the office?
Yes, I always suggest having 3 emergency contacts. So you're going to have 3 different people on that list that you can call. Start with the first. Normally the patient will put them in order of what they would want done anyways for emergency contact wise. Start with the first until you get an answer. Just keep calling them all. If nobody answers, you can send a text. You can't get details, but you can ask them to please call the office that there is a situation that you need to speak with them about. But that way, there is somebody that's either going to meet them at the hospital when the patient gets there and or meet them at the office. And that way we have those emergency contacts in one area, and same thing, we can hand them to the paramedics. If we don't get a hold of them, they will know who to get a hold of.
Love that. I know, when we talk about OSHA, we're talking about, patient safety, right?
Yes.
But to me, when it comes to emergency contacts, I think it's also a friendly reminder. Do you have emergency contacts for your team members? I personally had team members over the years that, I remember years ago, I had a team member who had a seizure, and we were like, oh gosh, first of all, we didn't know that she gets seizures, and second of all, where's her emergency contact information? And thankfully we were able to pull it and start making phone calls to friends and family on her list, but it was really scary. And so having these protocols in place will help you whenever it hits the fan, right? And you're like, gosh, what do I do? Well, that's why we practice this.
Yeah. It needs to be something that's in our new patient packets, and it also needs to be updated once a year.
Yes.
I know a lot of offices, they like to just have them update their medical history once a year. I would actually have them do the whole packet, especially for their emergency contacts. Things change, people's lives change, their situations change, so they may have different people to put on their emergency contacts every year. So just allowing them to update them once a year keeps everything front of mind, and we know those are the ones that they truly want us to contact if there is an emergency.
Love that. So as we wrap up OSHA, is there any other big highlights that you want to kind of point out?
Just making sure that we do this once a year, making sure that we have our officers in place. I would review them at least twice a year so that everybody keeps front of mind on, okay, this is going to be my role, because what happens, there's yes, I know what I'm doing. And then emergency happens, our nerves kind of get to us a little bit and we forget.
Yes.
And that is just being human. So when you're able to role play and you know what your roles are, and or maybe having a checklist up front of everybody's roles and responsibilities during an emergency, that way we can get on our headset and say, hey, this is what you need to do. Remember, this is going on. And we can actually make sure that the environment stays nice and calm for our other patients that are in the office.
Love it. So guys, if you need any help on implementing some of these OSHA practices into your organization, please reach out to us. We'd be more than happy to help guide you or point you in the right direction for getting an OSHA officer in your practice. Otherwise, guys, we can't wait to see you and serve you soon.